Dr. Biju Jacob is Director Health Social Alpha and he's also Director UN Health Innovation Exchange. Over to you, Doctor.
Hi, good afternoon, everyone. Thanks, Jose and Future ICT for this opportunity, and thank you so much for the moderator. As long as the alternative career is not a spy job, I think it should be okay. I actually feeling so embarrassed to stand here immediately after the neuro presentation. Somebody who is demonstrating obesity here on the screen. I thought I have to worry only that in between I'll remove my pants and go to pajamas, but now I have to worry about my obesity as well. Well, in Kerala, there is a saying in the Christian community, the priest said, alcoholism is bad, people should not touch, the families are suffering. Immediately after that, the priest had his round of single malt inside. So the deacon asked, Father, you did this to others, and why are you doing this? So that's for the believers. I do believe in it. Yeah. By training, I'm a medical geneticist, and I led research for Narayana Health Group for the last decade. I've set up the clinical research and translational research for them. My day job was to introduce new technologies, work with pharma device companies, come out with new technologies, do randomized controlled trials. Usually we talk only after publishing things. Today I'm here out of a chance which Manaswini, my colleague who was supposed to come in here, could not join yesterday, and she asked me, could you please cover for me? And she told, you owe me a treat. Then yes, I'm ready to come in. So I've come in. I head the Health for Social Alpha. Social Alpha is a multi-stage innovation curation venture development platform, which initially supported by Tata Trust and now with multiple, more than 100 different LPs and backers. I'm also the country director for United Nations Health Innovation Exchange. We are hosted in India by Social Alpha. We've heard about amazing technologies here. Neura is still not going from a brain. Triage and Odente, we've heard about future of health, a bit of it here. But it will become reality when if we can scale this, right? So one of my work is how to work with innovators and entrepreneurs to scale innovation, and in Health Innovation Exchange, picking up technologies which work for emerging economies. That's the Global South. For the Global South, that's what my day job now like. As I've mentioned, I'm representing Social Alpha today, so the slides which Manaswini has put up, I just tried to justify it. As Social Alpha, what we do is, most of the market failures, as we call it, when it comes to a solution for health, or when it comes to a problem like TB, or many of those places, which is not so-called the cool area where the private equity don't come in, which is supposed to be the majority of the problems which we face, not only just in health, in multiple places. How do you kind of come out with a new way of venture philanthropy or new way of funding instrument, if it's a blended instrument or multiple things? Also, how do we bring in ecosystem which would help that entrepreneurs who's making a difference? How do we bring in support for validating their technologies? How do we take that to market through market access? So that's what we do in nutshell as Social Alpha. It's a 5-year old approach to entrepreneurship. The core theme is about global impact or finding solutions towards SDG goal through betting on mission-driven entrepreneurs. We support mission-driven entrepreneurs. But the difference here is comparing to the core venture route. Here, we support them not because of the return, but the impact is the key factor. We support mostly on the social entrepreneurs who are really having difficult problems to solve. If it is a general digital health or any of those kind of areas where the mainstream investors are investing in, we don't get in there. So that's a core difference. So wherever it is difficult. I'll run it through an example. One of the technologies which we supported 5 years back is voxel grids, which is a portable MRI. Few of you must have done MRI here, and whenever a new technology comes in from 1.5 Tesla to 3 Tesla or moves into high resolution 5 Tesla, in healthcare, unlike in financial sector or banking sector, when it comes to a new technology, the cost escalates, and a solution in health is not a solution if it's not affordable. And in India, if you look at near about 60% of people, it's out-of-pocket spending. 100 million people globally go push behind the poverty line because of the healthcare-related bankruptcy. So in such a scenario, we have to have affordable solutions. One of the technology which is supported by the voxel grid, which was a low-cost portable MRI, helping that entrepreneur through the journey, fighting it out with the consolidation players like Philips, GE and all, and see that we could put it in that price point was something which we're trying, and to a certain extent we've been successful in that. One other example, this process, we call it market shaping, is black frog technologies. So the technology is something which is used for last mile immunization or vaccine delivery. Would you believe if 25% of all the vaccines which is given, liquid vaccines, are wasted because, or it is ineffective because there is no last mile cold storage or cold chain maintained? So we wanted to bring in a technology, but it's expensive, battery driven. How do you bring in market shaping mechanisms like Gavi did for vaccination? So that's something which we've attempted with those technologies. As you see, this shows the engagement structure. It goes from curation of innovations which solve for the key problem. We define problem through a thesis like a regular VC's vigor, but we look at the problem statement in a way with which it's a difficult mark to solve, do an evaluation properly, then bring them into the pathway of supporting them in what stage it is. So we support science and technology innovations, helping them accelerate their technology readiness level from stage 1 to 9, all the stages we work. What kind of support, if it's design to manufacturing, if it's clinical support, all those kind of things we provide with collaborators. That's what we do. This is a snapshot of the 5 years journey. And we work with all the players. There is no competition with anybody like venture firm. It's I don't work, or Sequoia is a competitor for Axel. We don't have competitors here. If a mainstream player's investment is working, then we stop that activity. We move into something else. And once these problems of are solved, Social Alpha's need is not there. So we look forward to working with all of you in any of these areas to support mission-driven entrepreneurs. And I believe 3 things, will accelerate soon. So health is pre-COVID and post-COVID now, right? So one thing which made change, like mRNA vaccines, was a possibility earlier. mRNA technologies could have been used for managing or controlling cancer, but we had to, we waited for a pandemic to support that. Now, quickly we can develop vaccines. The same way, technologies can only solve, or if you look at less privileged, low middle income countries require more technology than the developed countries. Most of the time, technologies are developed in the context of developed economies, which has not been adopted in these places. So now post-COVID, we have an opportunity where we can accelerate this technology, take healthcare beyond the 4 walls of hospital. We can bring it into continuum care, detecting disease in preclinical stages, managing it remotely, and we can do care continuum. So the major killer, which is non-communicable diseases, as Dr. Ahmad was mentioning, most of it can be managed remotely, and we look forward to that future. Thank you so much.